Hello and welcome to Third Thursday with GBLA. We're going to give it just a couple more minutes before we get started to let other attendees join. So just bear with us for a few minutes and we'll get going. All right, so welcome. This is Third Thursday with GBLA. We have a presenter today from our Advancing Health and Racial Equity Through Legal Strategies project, our project coordinator, Gabriela Gomez. I just want to go through and do some quick introductions. My name is Cassie Mulliken. I am the Marketing and Communications Coordinator here at Greater Bakersfield Legal Assistance. We're so glad you can join us for our webinar today. We host this third Thursday on the third Thursday of every single month. And each month we feature either a different program, a service, or information about certain civil rights for individuals. So this month we're going to focus on some Medi-Cal eligibility. And with that, I'm going to go ahead and let Gabriela Gomez take over for the presentation today. Thank you. So sorry, real quick housekeeping. If you have questions throughout the presentation, please feel free to use the chat or the Q&A box. And then we will have times for questions and answers towards the end of the webinar. So hang tight, we'll get started in just a moment. No, we can't hear you. There we go.
Can I get, it says host disabled participant screen sharing when I clicked it.
Okay, now you should be able to.
There we go. All right, can you see my screen?
Yes.
Excellent. Okay, hello everyone. Like Cassie mentioned, my name is Gabriela Gomez, and I'm the project coordinator for the Advancing Health and Racial Equity Through Legal Strategies project. Today, this presentation is on the path to good health, Medi-Cal and covered California eligibility. It's one of a series of presentations that I was able to develop for this project, specifically about California's Medi-Cal plan. And the reason for the development was I felt like there were some things in the Medi-Cal program that people should know about, because this program is very intricate. And so it kind of gives you bare bones information. So this one specifically is on eligibility for Medi-Cal and covered California. So this is just a disclaimer. It basically summarizes that I'm not an attorney, and this is just general information. That this presentation does not mean that there is an attorney-client relationship whatsoever, and we do ask anyone that is looking to take legal action to please consult an attorney before doing so. So just to give you a little overview of the presentation, the first one is we're going to be talking about acknowledging your healthcare why. Knowing your path to good coverage, because everybody's path is going to look a little bit different. So it does make a significant difference in some cases. Minimum essential coverage, what is Medi-Cal, the eligibility requirements for Medi-Cal, and what is covered California. The next tab over is spill the tea on tax filings for covered California. There's a little bit of information on how to do some tax filings for when you have a coverage under covered California, your eligibility requirements for covered California, and the conclusion and contact information. So acknowledging your healthcare why. So upon doing some research on this, it's always good when you're looking for coverage to always go back to your why as to why you're looking for health coverage. And feel free to post or share your comments in the chat of, why or what you've seen for health coverage, just because everybody's situation is going to be a little different. For some people, it's because they don't want to have to pay back taxes at the end of the year when that time comes around in January. But if you need more of a reason, now more than ever in the state of California, healthcare coverage is attainable. And that's thanks to the Affordable Care Act of 2010. Another thing is that medical debt is real, and we see it in our public health and benefits unit. We do see a lot of, some people end up in the hospital and they're having to pay thousands of dollars for a procedure, and they don't know how to seek out some form of financial help for that. And health is one of our biggest assets. I think a lot of the times we always prioritize ourselves last when it comes to our healthcare. And I think we need to kind of change that and really advocate for ourselves when it comes to our health. And then also, paying less for medical access is also an added bonus. But if you need more of a reason to have medical coverage, it is the law in the state of California. So if you qualify for Medi-Cal and you meet the income requirements, or if you don't meet the income requirements for Medi-Cal, then you can purchase healthcare through Covered California. And you can do it with or without federal tax credits. And you do have access to alternative healthcare coverage. If that's some other option that you would be interested in. There is a tax penalty in the state of California. Every state is different, and it can range anywhere from $850 per adult for a year, or $450 per child for them not being covered. So you'll see kind of this little excited celebratory thing, is because I always try to think about coming in a sense of like, how do I let people know it's coming from a place that's dear to my heart, in the sense of advocating for this. So I would really highly recommend that any form of coverage is better than no coverage. So I put this slide in here. This slide really shows in detail your path to good health coverage will probably look a lot different than mine. There are 5 different accesses to healthcare in the state of California. For some people, that's going to be Medi-Cal. For others, it's going to be Covered California. If you're over the age of 65, it would be through Medicare if you qualify. And for some people, if they're working, it'll be through their employer or through the private healthcare marketplace. And the reason why I put these pictures here is because, for someone that is single, their healthcare coverage might come in a different form than the healthcare needs of a family that just had a child, or for someone that's over the age of 65. But it's all leading to the same way, to get some good healthcare coverage. Minimum essential coverage. So under the Affordable Care Act, healthcare coverage must be a qualified plan. So for it to be a qualified plan, it must have all of the listed here essential benefits for it to qualify. I would highly recommend, if you're unsure if your coverage falls under the qualified healthcare plan, that you contact your provider and find out if it is or not. Medi-Cal and Covered California, they do meet these requirements. So some of the requirements that you see here are ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder, prescription drugs, rehabilitation and habitability services and devices, lab services, preventative and wellness services, and chronic disease management, pediatric services for children, and then oral and vision as well. Things to consider. So make sure if you apply for Medi-Cal or Covered California on your own, that you visit the actual Benefits Cal website or the Covered California website. A lot of the things that individuals run into when they're applying for these is they will Google search the Medi-Cal website, and they end up in a totally different website, and sometimes even end up with third-party broker websites. and it's not the official Benefits Cal or Covered California website. And that becomes an issue because sometimes the third-party broker, they generate something from them helping you get that when there's so many free options of organizations that are certified enrollment specialists that can help you get the coverage you need if you need help applying. So I posted the 2 official web pages for both Medi-Cal and Covered California on this presentation so that you don't end up on a third-party broker website. If you need help enrolling, some examples of places here locally that can help you enroll are Garden Pathways, Catholic Charities, CHI, which is the Community Health Initiative of Kern, and Dignity Health. So what is Medi-Cal? So the Medi-Cal program is California's essentially Medicaid program that falls under the Social Security Act. And this program is required, and it's to cover a wide range of healthcare services from infancy to end of life. So the program is intended to address the healthcare needs of lower income communities. And here in the state, it's our largest public health coverage program. So this program is intended to help some of our lower income communities, but some mid-income income families or individuals may qualify. It just depends on a couple of requirements. So there's in Medi-Cal, there's kind of two pathways. Two pathways is the way I look at it. Is you have restricted Medi-Cal and you have full scope Medi-Cal. So restricted scope Medi-Cal is often referred to as emergency Medi-Cal, and it covers a limited amount of services. So an example of that would be if your health is jeopardized, if it affects your bodily health, or if there's a dysfunction of a body part or an organ. Or there's also under full scope, there's full scope Medi-Cal, where it covers a full range of physical, mental, vision, and dental health coverage for the individual. And under this one, just because recently we've been hearing that a lot of the times people don't get into the doctor as much because of the fear of having to pay. Under full scope Medi-Cal, you do get 100% coverage for preventative care. And I think it's very crucial that if you have Medi-Cal, full scope Medi-Cal, that you take advantage of it, just because it does help detect illness early on for more effective treatment for the individual, and avoiding anything later on that could be detrimental or deadly. This is just a medical access reminder. It's one of my favorite slides, just because a lot of the times individuals run into something in life. Maybe they develop some form of cancer, and a lot of the times they feel like they can't or don't have access to healthcare. It's always okay to reach out to one of these certified enrollment specialists and seeing if there is something that happened to you that you think you may qualify. You never know. It's worth trying and seeing if you would qualify for Medi-Cal for something. There's sometimes even if you didn't qualify, that individual may be able to refer you to a program that may help you with a life-threatening or medically necessary procedure. So eligibility for Medi-Cal. So Medi-Cal uses the 138th of federal poverty level based on household size for individuals for Medi-Cal. Now, there are some exceptions. There's some programs under Medi-Cal where there are exceptions. So there's the non-MAGI. MAGI stands for Modified Adjusted Gross Income. And so, some examples are the 250 Working Disabled program, the Medical Access Program, which they call MCAP for women that are pregnant, or the 266 Medi-Cal Targeted Kids Program. These are just some examples. And in this case, if you wanted to see if you would qualify, again, going to a certified enrollment specialist and kind of talking to them with your particular case might, you may be able to qualify for some of these programs. Now, they do use this, but they also do keep in mind that there might be different households in a single family unit. So they do take into consideration if, for example, there's two separate families living in one household, but one family is trying to apply for Medi-Cal, there could be a chance that they qualify regardless if they're living with a separate family in the same home. So here's just a chart where it tells you the income and household size. So here on the left, you have the number of persons in the household and how much they would make monthly under the 138% of the federal poverty level, and then how much they would make annually. So this chart kind of gives you an idea of where that income threshold is monthly and annually. And here at the very bottom is another advocate announcement. 138% of the FPL is for Magi Medi-Cal expansion adults and non-Magi aged by the disabled. So if you don't qualify for Medi-Cal under this particular criteria, you may qualify under a different program. So again, it's always safe just to go through a certified enrollment counselor, just so you can see if you may qualify under a different program if you don't qualify with this. So eligibility continued for Medi-Cal is California. Residency is required to receive Medi-Cal, and it does ask that the individual is 21 years of age or older, that the individual must live in California or have intent to reside in California, or is seeking employment here in the state or have a job commitment. So things just to remember: if you have just moved into the state, you cannot be denied eligibility based on residency alone. So again, something to bring up to your certified enrollment counselor if you run into some issues with this. And there's no maximum amount of time someone must be in California to have residency. A couple of other items to remember under residency is children under the age of 21 can use residency of parents or caregivers, and the individual does not have to have a fixed address to be a California resident. Given example is if it's a homeless individual that qualifies for Medi-Cal, they could always have their paperwork sent to their case manager, for example. If an individual is not able to indicate residency, it does not necessarily rule out access to Medi-Cal. So again, I can't stress this enough. Like, it's always good just to check that off or rule it out with a certified enrollment counselor. So continuing citizenship, low income, and the monolingual. Medi-Cal in the state of California is available in some form to all monolingual and low-income individuals. You don't necessarily need to have your citizenship to qualify for Medi-Cal. I think that's one of the issues sometimes we see. People will assume, like, if I don't have citizenship, does that mean I don't qualify? Not necessarily. Your immigration status only determines the scope of the services under Medi-Cal. So as long as you meet the eligibility requirements that we just mentioned, that you may qualify for a program. And one thing to note here is the Department of Human Services, which is the agency in California that runs the Medi-Cal program, cannot disclose your immigration status. And one thing that I put in this asterisk is you have also the right to receive any correspondence from DHS in your primary language. So if you request it to the service agent that you're getting help with, they should provide it in your primary language, whether that be English or Spanish, whatever language is it that you need. This is another advocate announcement. Right now, full scope Medi-Cal is available to older adults 50 or older, regardless of immigration status, if you meet the requirements. And coming very soon, which is so exciting for the state, full scope Medi-Cal will be available for adults 26 to 49, regardless of immigration status, starting next year in January, as long as you meet the income requirements. So once you're found eligible for Medi-Cal, Medi-Cal does run under a two-plan model. So you will be asked to choose which plan model you would like for healthcare coverage. So one of those is HealthNet. and they're not available in Rosemont, but there also is Kern Family Healthcare. And you may switch plans by contacting healthcare options. And you can also remain to stay without medical exception request for qualifying medical condition. I will say this, I would definitely recommend that once you are qualified for Medi-Cal, and I would definitely recommend looking over the HealthNet and Kern Family Healthcare reference book with like the different providers and so on and so forth, so you can kind of assess which tool model plan would work best for you. So next we're going to touch on Covered California. So Covered California is California's health benefit exchange under the Affordable Care Act, and California residents can purchase comprehensive health benefits. So it does meet the requirement of meeting the comprehensive health benefits under the Affordable Care Act as minimum essential coverage. And some residents are eligible for financial assistance by either having cheaper out-of-pocket costs, or you won't have no pocket costs in the form of tax credits. And so we'll go into that a little bit more in a second. Oh, I did forget to mention, so under Covered California, the providers are HealthNet, Blue California, Kaiser Permanente, and Anthem Blue Cross Blue Shield. So this slide in particular, just because Covered California works a little bit differently in this way than Medi-Cal, is the tiers of coverage that you have under Covered California. So it's kind of, the best way I could describe it for you is kind of like purchasing like your own it's healthcare insurance, but almost like coverage for like car insurance on your car. The different tiers are the metal tiers of bronze, silver, gold, and platinum. And the percentages that you see here is how much the plan will pay towards the total cost of services. So generally speaking, the platinum, gold, like the higher the tier, a little bit more out of pocket cost premium that you will have to pay. And I'll explain that a little bit more on the next slide. But usually I do recommend to individuals to really assess, this is when the paths, right, of your healthcare coverage are going to look a little differently for many people. Give you an example, say for someone, right, that maybe has one prescription every month. It's just an example. I'm using myself. This was actually me in real life. You need one prescription. And so maybe getting the silver plan might help a little bit because they're paying a little bit more than maybe the bronze for prescription medication. It just really depends on what your needs are and how much medical help you may be seeking. So always, if you do need some advice on how, kind of navigate it, it's always good to, again, contact an enrollment specialist to kind of go over the different tiers with you. So this is just an example so you can kind of see how Covered California works. So the coverage year we put was 2023. And this tool is actually available on the Covered California website. So that way, before you make an account or before you go shopping, you can actually use the shop and compare tool to kind of navigate it. So it'll ask you what your zip code is, what your household income per year is. So in this case, for the example purposes, we put 30,000, how many people in your household, and then the age of the household individual. And it will ask you these questions here on the side to assess to see if you, because it also tries to see what other services you may need and kind of generates the different tiers for you based on your needs. So once generated, it pops up here. So in this particular case, for this individual that makes, right, that's a single person making 30,000 a year, their monthly premium, which is this number here, which is the 251.44, is how much they're getting in the form of tax credit. And their monthly premium is how much they would be paying out of pocket. So just to give you an example, here's this bronze tier. So it's going to pay around 60%. I will be paying, $13.42. but it'll also list here how much I would be paying for a primary care visit or a generic drug. But again, it's always good to see in detail what other coverages or how much you're going to be paying out of pocket, just depending on how much you're willing to pay out of pocket, and how much coverage you need from each healthcare provider. So tax credits do offset the cost of health insurance premiums. So just like you saw in this last example, here after the savings of $251.44, if I were to choose Health Net Bronze in this particular case, I would only be paying $13.42. And because the tax credits are taken in advance, the tax credits will be reconciled when filing taxes for the following year. So at the end of the year, you'll receive that tax reconciliation document from Covered California, so that when you complete your taxes, you'll be able to reconcile them. So just spill the tea on tax filings. So taxes must be filed for the year that if you received a premium tax credit. To reconcile them, you need to file taxes. Individuals need to file the taxes even if they do not have tax credits to report. So the reason why is being taxed, the tax requirements are still need to be met regardless. And individuals can enroll in plans with tax credits and may be subject to IRS filings and penalties if they're uninsured over 3 months. So you do have, for example, if you're in between jobs and you lose coverage, you do have that 3 months where if you were to file your taxes, you wouldn't be penalized for not having it. But after 3 months, they do begin counting that time where you could potentially pay a fine at the end of the year. Just a quick reminder, Medi-Cal, Medicare covered California, employer coverage is considered comprehensive care. So if you're uninsured for those 3 months, you may be subject to a penalty. So please, this is on here on purpose. Do not forget, a lot of individuals do not know that they have to do this, but to report any changes in your income throughout the year to Covered California. Just to give you an example, you need to verify if any additional income throughout the year, if it has changed while you're on Covered California, that you report it to them. Otherwise, when it comes to reconciling your taxes at the end of the year and say there was an income increase, for example, and they see that there was that income increase, they might actually be asking for some of that premium that they paid for back. And it's for every single month that you had the coverage. So please, if you know that there's a change in income, the phone number is here to verify if you need, if there was a change in income. So Covered California's monetary system comes in the form of tax credits and cost sharing reductions. Individuals must lack minimum essential coverage for that financial assistance and be income eligible, and again, agree to certain tax filing requirements, which again were listed on that previous page of filing your taxes and reconciling them at the end of the year. So how the individual gets to tap into cost sharing reductions. So cost sharing reductions, which is the other way that you get financial assistance for Covered California, will come in the form of lower deductibles, lower co-payments, or lower co-insurance. The household is expected to make $250 less of the FPL during the year. And in order to tap into those cost sharing reductions, an individual has to enroll in a silver plan to get the reductions. And so what happens is when that individual signs up for that silver plan to get these reductions, what ends up happening is the value of the silver plan ends up being higher than the platinum plan, right? But you're paying the silver plan cost. So you're essentially getting coverage at like a platinum or better coverage, but only having to pay silver plan costs. So things to consider is premium price is heavily affected by the value of the plan here. So again, your premium is how much you're going to be paying monthly toward your health coverage. And then the tier is listed on there as well. So one thing here is consider the total cost of care when shopping for this coverage, how much enrollees must pay before many services are covered. So you also want to look at your yearly deductible, how much you're going to be paying every time you go to the visit. I mean, for example, here in this example, if I get the silver, I only pay $45 versus $65 every time I go to my primary care visits, not counting preventative visits. So individuals' specific healthcare needs will impact which type of plan they're purchase. So again, everybody's path is going to be a little different. Everybody's healthcare needs is going to be a little bit different. So you assess what would be the best plan and cost for your pocket costs. So eligibility, income and household for covered California. Your household income determines the level of financial assistance in the form of tax credits to offset the costs. So for covered California, it's going to be a little bit different than Medi-Cal. The entire household will be considered for the application. And again, things that they look for is if that household is lacking the minimum essential coverage. And then also, again, when you go through your questionnaire, they need you to agree for those tax filings. The other thing about covered California is that there is periods of enrollment and qualifying. So generally speaking, November through January is the open enrollment for covered California. But there are exceptions. There are periods of life events. And then if you see here, this link here will tell you other qualifying life events where you could qualify to get on covered California. So one being, for example, if you just recently got married and you and your spouse are looking for coverage, that would be considered a qualifying life event where you can go in and apply for coverage. There's no age requirement for covered California, but individuals 65 or older, they are disqualified. Are disqualified from covered California on I believe it's Medicare. Yeah, Medicare. So residency, only California residents can purchase covered California plans, and again must be 21 years of age or older and live in California. And there must be intent to reside in the state of California or be seeking employment. Children under the age of 21 can use the residency of parents or caretakers to determine residency, and a homeless individual can have California residency without an address. And then just a disclaimer for anyone that moves into the state of California, they do have 60 days to apply for coverage. So things get a little bit, it's a little bit different with covered California when it comes to citizenship, low income, and the monolingual community. Individuals must be a U.S. Citizen, nationals, or lawfully present immigrant. So lawfully present could be an LPR, an asylee, a refugee, a Cuban Haitian entrant, a paroled into the U.S., and then just bear with me, there's a long list here of what would qualify for someone to be under covered California. So anyone that's a conditional entrant granted before 1980, battered spouse, child, or parent, victim of trafficking, spouse, child, siblings, or parent. You've been granted a withholding of deportation or withholding of removal under immigration laws or the Convention Against Torture. Individuals with non-immigrant status, lawful temporary residence, temporary protected status, deferred enforced departure, deferred action status, which is different than deferred action for childhood arrivals, which a lot of people know as DACA, administrative order stay removal issues by the Department of Homeland Security, members of federally recognized Indian tribe or American Indian born in Canada, residents of American Samoa, temporary protected status with employment, CJIS or special immigrant juvenile status, victims of trafficking visa, adjustments to the LPR status, asylum 20, and withholding of deportation or removal under immigration. These are just some of the last ones. So laws under the Convention Against Torture, CAT 0.21, registry applicants, order of supervision, applicant for cancellation or removal or suspension of deportation, applicant for legalization under Immigration Reform and Control Act, or legalization under the Life Act. So things to consider. If you have coverage through your employer, it is considered qualified health insurance. So that, if you're working and you receive through your employment, that does qualify. However, if you no longer are enrolled for whatever reason through your employer, Medi-Cal or an alternative source of insurance is highly recommended. And it is an option. Just because even though, yes, you do have that 3-month period open where you don't get charged at the end of the year, you receive that penalty, it doesn't necessarily mean that life won't happen. What if you have to go to a hospital stay and you don't have coverage? Or, recently with the pandemic, way before we had, the COVID protections, a lot of individuals that didn't have healthcare were going into hospitals, maybe didn't have coverage. So to kind of avoid that what if situation, any form of health coverage was highly recommended. And one of also being for tax credits. But again, very important that if you plan to stay on covered California, if you leave your job or your income changes, it's and report that income change. COBRA is another alternative to avoid that monthly coverage in between jobs, but it does tend to be a little bit pricey. So, but it is an option. And then you have those 3 months gaps in coverage without having to pay the penalty. Conclude the presentation. Thank you for your attention to the presentation. Feel free to have questions. You can put them in the chat box. That way we can, read them one by one. But please don't connect with us. Have our main line here listed, and the Department of we have our Health Consumer Center. If there's any questions have relevance to this presentation, of our Fair Housing Law Project here and how to contact us. Then here's just some the Kern Health Consumer Center, again, and then also my contact information.
Thank you, Gabby, for the great information. That was very informative. So I am checking through the Q&A and the chat. I'll give you guys the attendees that are on with us a few moments if you have any questions or would like some more information about anything in particular during the presentation. Okay, so I don't see any questions at this time. So with that, we're going to go ahead and conclude Third Thursday with GBLA. Thank you so much for taking the time to join us today, and we'll see you next month. Have a good day.
Thank you.